And do they finally have a voice, or is this just another report?
I think this is the beginning, not the end, unfortunately, in terms of the grassroots movement. We've known these problems in aged care. We have had numerous people write to us on our Facebook page telling us their problems in dealing with the aged care homes and with the regulator and with government bodies. It's quite endemic.
Anna Willis, when we look at this, we knew these problems existed. We've known that these problems have existed for 10 years. Has anything improved over that time?
I would say things have got worse, actually, in terms of the training of staff, in terms of the quality of staff, in terms of the staff being supported. Also in terms of information provided to carers and people that are seeking assistance in aged care, that's become far more complicated. So there's a systems issue, and there's also an issue with respect to priorities on how we assist people in aged care.
I accept that this is going to be a big ship to turn around. Do you accept that? It's going to take time?
I think bits of it will take time. I think there's bits that we can do now, and I think we can start off with accountability. Over the last 10 years, there's been numerous amount of funding provided for dementia support, for advocacy support, and yet we continue to get numerous complaints about the way those services are handled. And instead of using complaints as a way to reform our system and change our system, we bury them. So I think it's about time that there's certain things, there are kind, considerate people working in aged care that are trying to do the right thing with limited resources. There's things we can do right now.
What should be done immediately?
I think dealing with the staff issue is really important. Dealing with the training of staff in terms of independent bodies and in terms of the number of staff, mandating number of staff. I think we need to look at accountability and some of the governance issues. So the Royal Commission actually can be looked at in terms of 6 key broad priorities, and one of them was governance, and governance is to do with accountability with aged care providers, which is saying there's a bit of a misfit between the bodies, the board of maybe a main organisation, not really being accountable for a subsidiary that's providing aged care help. So there's definitely staff issues, and I think governance issues that can be, and accountability issues that can be dealt with straight away.
Well, staffing is one of the biggest issues, as you've just laid out there. But where do you get staff from? I mean, it takes time to train them, but where do you get the actual people from? Are they already in Australia? Does there need to be a special drive to bring in workers from overseas?
I think that's an interesting question. In my personal, I don't really have that information, but in terms of my personal experience, I know there's a big turnover of staff. There's availability of staff, and from the complaints that we receive on our independent complaints tracker, it seems to be more to do with the staffing ratios and the way that staff rosters are put together than the actual number of staff. But I acknowledge there's probably issues related to the recruitment of staff.
I mean, we hear some of these horror stories, though, Anna, that, you know, there's 2 registered nurses on to look after 70 or 80 patients. You hear that aged care patients have been left in their own soiled underwear for 5 hours. They're not showered for days. They are isolated. And the list goes on. It comes down to bodies as well as training, though, doesn't it?
Absolutely. But I think, again, going on the complaints that we actually receive from staff working in aged care, and, you know, we don't have, I don't have a statistical solution, but from the minor feedback we are receiving is that the management of the staff in terms of the rostering of the number of staff, and there's continuing cutting back in the roster of staff. So it's the number issue, but there seems to be some availability. So there seems to be a problem at the moment with some of these providers running at minimum staffing levels where staff are available to work.
And we tend to look to government to solve all issues. There's been some kind of suggestion that there's a cultural problem here among our attitudes to older Australians. Do you buy that?
I buy some of that, but I think from what I see is that we've got the ageing population we have is actually quite a smart, professional ageing workforce, and people that are in aged care, especially the ones that are actually dealing with aged care reform now and giving us feedback, are actually saying that there is a little bit of that stigma, but I think it's got more to do with the fact that we are not even providing the minimum standards that society would accept. And the Royal Commission actually said the Australians are concerned, they're willing to dig into their own pockets to provide support for aged care. So I think that has shifted.
Anna, what do you say to our viewers today who have their parents or grandparents in aged care that would be really anxious hearing these reports today? Is it as bad as it's laid out, and what should they do?
I think we need to be involved. I think we need to be involved in the process. I think Australians need to demand that we are part of that, that us, the carers of aged people and aged people themselves, are part of the solution, older people. Mm-hmm. I think for too long, these decisions have been made without their input, and I think the Royal Commission attests to that.